Hello and welcome back. As participants trickle into the room, I'm your host, Greg Lindsay, Director of Research here at New Cities. Welcome back to our afternoon panel here on afternoon Eastern Daylight Savings Time, I should say, here on the second day of the Wellbeing Cities Forum. It's my pleasure here to promote our next panel here, which is going to be focused, of course, on the intersection of public health, social connections, and sort of facilitating community in cities. And of course, once again, the pandemic, of course, globally, and here in sort of North America, the wildfires in the West, the Hurricane Sally, which has just struck the Gulf Coast, all underscoring once again the findings, of course, that social resilience and community is critical to surviving natural disasters, and also sort of providing support to each other during a time of crisis like the pandemic has done for the last 6 months. And so we are honored to have a great group of panelists here today to discuss these connections about how do we basically foster social infrastructure in our communities and tie notions of public health and well-being to these sort of cross sectors and sort of buttress them together. And to do a better job of explaining that and kick things off, I'd like to hand over to our moderator for the session, who is Jennifer Castenson. She is the Vice President of Programming for Hanley and a contributor to Forbes. Jennifer, the floor is yours.
Hi, thank you so much, Greg. I really appreciate it. And thank you to Next Cities for putting together such a great conference with so many incredibly relevant topics. We will be addressing today tools for living in a connection and facilitating community. I am honored to be with a very esteemed panel, and I will have them introduce themselves, but we have Ivey Boufford, the Dean of Robert F. Wagner Graduate School of Public Service for NYU, François Pitti, the Group Director of Strategic Marketing at Bouygues, and Jaana, Remes, the partner at McKinsey Global Institute, and Kim Samuel, founder of Samuel's Center for Social Connectedness. And I will let them, like I said, tell you a little bit more about themselves, keeping it as short as possible because we have a lot to dig into, but starting with you, Kim, please.
Thank you very much, Jennifer. It's a pleasure to be here. My passion is really about what this subject is about inclusive communities. It's about social equity and making a strong case for belonging as a birthright that all of us are entitled to, and yet looking at all of the inequities that we see happen and leading to things such as social connectedness and loneliness that are very pervasive. Very happy to be here and share whatever I can.
Wonderful. Thank you, Kim. And François, can I have you go next?
Hello, François Pitti. I'm leading strategic marketing and foresight for Bouygues Construction, which is a company headquarters in France, but present globally. And we are very active on designing and building, of course, servicing a number of building and district projects, and with an increasing focus, of course, on these key topics of inclusiveness, social community, and global ecosystem, and how to be relevant globally, of course, but very importantly, locally in the projects. So looking forward to exchanging with you on these topics.
Wonderful, thank you. And I think what we'll find is that at the bottom, at the root of everything, global doesn't matter. Everybody is the same. We need the same connectedness. So Joe, can I have you go next, please?
Just to clarify, I'm no longer the Dean of the Wagner School. I don't want Sherry Glee to feel that she's being misrepresented. I'm a clinical professor of global health at the New York University School of Global Public Health, and also chair of the board of the International Society for Urban Health. And the focus for me in cities is particularly exciting because I think anybody working in the urban environment has to work with multiple disciplines, multiple sectors, look at politics and the political influence of leadership, as well as the needs for community engagement and addressing disparities. So all of these issues are pretty front and center in the urban environment. And part of the work is really getting people to think about human health in the effects of on human health of decisions that are made in cities around a lot of other infrastructure, both built and natural environment projects and other things. So I'm excited to be here and to learn from my colleagues. Thank you.
Wonderful. Thank you, Joe. And sorry about the title. We did talk about before that we are going to, our speakers can put their LinkedIn profiles in the chat feature. So if you want to reach out to them and learn some more or connect, their LinkedIn profiles will be in the chat. And Jaana.
Good morning, good afternoon. I am Jaana Remes, a partner at the McKinsey Global Institute. I'm an economist, and for over 20 years now have led a lot of our research that focuses on cities as well as health most recently. And our focus really is to draw on the insights that McKinsey's industry and company expertise around the globe can bring into understanding some of the big economic and social questions of our times. And I'm drawing a lot on our 2 research projects recently that all of you have access to. They're freely available on the website. One of them is about smart cities and their potential impact, and the more recent one is about health. And I can, I think those are on my link, my information on the profile.
Great. Yeah, that's super helpful. Thank you, Jaana. And so the chat feature is open. So if you guys have questions, please submit them, and I will mix them into the questions that I have. And wanted to start, we were actually talking before we launched into this presentation that there's a lot of devastation in the world, and we want to start on a more positive note. So I want to start with talking about the opportunities to improve public health that you are the most excited about. So we'll hear from each one of the panelists responding to what they're most excited about on public health. And we'll start with you, François, please.
Yes, I would say the positive note, and in every crisis, and there is also a silver lining, and in the crisis we are living, health, economic, social. There has been, I see that in France, I see that also in Europe, we're interacting a lot with our European subsidiaries, a lot of reactiveness. And I would say there is one word in terms of the positive outlook of the bright side, I would say, is the resilience that we are seeing in a situation that never happened in the history of mankind, having 4 billion people in a lockdown, and having no limits to imagination, no limits to the way we use technology, whereby the last 10 years we've been smart cities being really top down. We got very decentralized responses on the health challenges, on the social and economic challenges. And I see that from a country which is very centralized, France, where we're seeing that trend. And on the health and social thinking and debate that we've been seeing last few weeks, this decentralization, reactiveness is at the core of the discussion. So I would say this is for me the one positive outlook that I take.
Great. Jaana?
Well, as someone who has been studying different industries and cities for a long time, healthcare industry in general and public health has been one that has been a slow one to adopt in normal times. And it is one of those sectors that is at the heart of the hurricane today. And this is not the first time when a crisis has led to real innovation and bringing in technologies to solutions. I think the Ebola crisis was one where, for example, tracking the clusters, being able to trace and quickly react was a key part for our global capacity of managing the situation. And I am really excited about the changes we are seeing on digital health right now. We saw a very quick change of adoption of telemedicine, for example, virtual visits, as well as patient self-care, so teaching people how to care for themselves or track themselves, and real-time tracking. This was something that some apps that have been made for chronic diseases and their treatment was quickly adopted to the fact that you could actually tell anybody who was in a quarantine situation, for example, you have to download the app, or you can download the app. Twice a day, you fill in your details. There is a professional who can track hundreds of people at the same time, because automatically the responses lead to either red, yellow, or green solution that then either you can say, we'll send an ambulance right away to take care of that person, or I'll give them a call to just check and do some more diagnosing, or someone who might have been 14 days on the green and is now ready to be released. And I think it's the fact that we have seen medical systems adopt them and patients find how helpful they are, they have a real potential to increase health. Because one thing I didn't know until my last research project, but one of the biggest challenges for maintaining good health for people at risk for cardiovascular disease, for example, is adherence to their medicines. So things like tracking and being able to make sure that people actually take their statins or cholesterol pills or hypertensive drugs makes a big difference. So I think our capacity to really bring digital tools to improve health is one of the things that I'm most excited about and where I'm seeing the most rapid change as a result of the crisis.
Yeah, that's amazing. And actually, I am in a vaccine trial and they're giving everybody an app to track the vaccine trial. So I can definitely say I'm witnessing that. And also another way that technology, this can be much broader, but I was talking to a home builder yesterday that is revealing a home in the next few months that will know your CO2 levels, you know, the output of your CO2 while you're sleeping, and then adjust the HVAC to balance that. And then also we'll able to tell the outdoor air quality and the indoor air quality, and even we'll send you an alert if your sliding door is open so that you can close it if the outdoor air quality is bad, and will also not filter the air. So lots of great ways technology is being used to help us and the public in the places they live. Kim, let's have you go next, please.
Thank you. What I'm most excited about, and I would add what my fellow panelists have said so far is also very exciting, but for me it's social prescribing, and that's a specifically structured way of referring people to a range of local non-clinical services. It complements clinical treatments and seeks to address people's needs in a holistic way. This is an asset-based approach that goes way beyond treating illness and recognizes people not just as patients with needs, but as whole people, as community members with gifts to share, while supporting them to engage with and contribute back to their communities. That for me is really exciting.
I love that. And it's something that I haven't even really thought about before. I mean, patient seems like a pretty good status, but if you go beyond what that really means, and it's not just an interaction, it's actually thinking of the ecology of it from a broader scale.
And to look at it also not as a transaction either.
Mm-hmm. Awesome. Thank you, Kim. Joe?
Yeah, I think, I would certainly underline the adaptability, innovation, and the use of digital. I think in New York City, especially, people have had a sense of identity as a city. I suspect that's drawing together in ways perhaps that it hasn't been as clear in other cities during the COVID epidemic. I think the one thing I want to highlight that's been a positive, but it's also becomes a responsibility. I think public health, as distinct from the personal healthcare delivery system, has finally come into the forefront, and it's the importance and to some degree the failure, I think, in many countries of investing in public health infrastructure to be ready to prevent these kinds of outbreaks, to be ready to guide an emergency response, and then most importantly, really looking at the conditions in communities which people in public health work on. It's a connection to what Kim is saying about connecting to broader services for individual patients who need them to manage their care. But similarly, how do you change conditions in the communities from which people come to improve their health possibilities and the outcomes? And a number of those really important issues that are very, very hard to bring to public attention have come forward in this crisis.
Yeah, those are really good points. And it really definitely systemic changes need to be made. Joe, staying with you, what do you think? We've already kind of touched on technology a little bit, but collaboration we haven't really spoken about. What role do you think technology and collaboration take in exploring some of these opportunities?
Well, I think the technology issue has enormous opportunities. I think Jaana mentioned the issue of telemedicine, telehealth, which just the use of it really exploded, and it had been quite constrained from a regulatory and financial point of view. So people really moving towards that direction. I think the challenge, though, is that there are many people who do not have access to either the devices or the broadband connectivity to participate in what you might call a digital revolution. And I think while the excitement and innovation in that space is a really important one to learn from, especially in this emergency, and to carry forward, we have to be cognizant of the fact that I know people talk about a digital divide, and I don't want to use that terminology as a euphemism. I mean, it is really clear that many individuals and communities don't have access to broadband connectivity. They don't have mobile devices, or if they do, if you're in a housing situation where you have a child who's trying to go to school virtually with a parent who's trying to work virtually with an effort to try to make connections, they don't have the kinds of devices. So it's raising a lot of interesting thoughts about centers and communities that might provide digital access, or on a standing basis that people could use if they don't have the access in their homes. But I think we want to make sure those travel together in terms of the real ability to use the wonderful opportunities that digital presents.
That's a wonderful point. Thank you. And let's go to you, François, please. What do you think about technology and collaboration as being part of the opportunities you discussed?
Yeah, I mean, definitely this is, I think, the key to me indeed, and back to what Jaana and Joe were saying, it's telemedicine was there actually before the crisis. There was this legal breaks, if you will, that I saw in many countries where we are operating were preventing us actually from using that, because a lot of it is not very high technology, to be frank, to be honest. But all of a sudden you got, and this is on the bright side actually, you got this regulatory obstacles that went down, and then there is an acceleration of the adoption of these tools all of a sudden, in just a matter of weeks, whereby for the last 10 years, they were more or less at our disposal. So I think this is one dimension. Second dimension, to Joe's point, indeed, we feel increasingly in the urban projects where we're being involved in terms of design, but this connectivity at the community level, if you will, is very important, both for the physical side, meaning the buildings, but also the digital, ensuring that we've got hubs, if you will, decentralized hubs that will be shared by the community, because not everybody's got 10 gigabytes or whatever gigabytes at home. So these are, to me, the two main aspects, and what is the bright sides also, back to the original question.
Yeah, no, it's definitely something that needs to be shared across the public. I know that there are schools here dealing with the pandemic and going virtual and having to distribute computers and to certain geographies within their districts. So Jaana, you did speak about technology, but this is an opportunity to talk a little bit more about that, and then also about collaboration.
Yeah, so I think I'm thinking about collaboration is such a key part for cities. It is cities that outperform others, and we have studied all the 3,000 large cities of 150,000 or more inhabitants in the world. When you really look at peer cities, and the ones that stand out are the ones where the different constituencies pull to the same direction. There is a clear priority for the city that everybody wants to happen. Oftentimes they are mid-sized cities. I mean, I sometimes talk about Oulu in northern Finland, where I'm from, or Medellin in Colombia. Not exactly the cities you usually think about, but they are cities where the business community, the university, the city, the civil community have actually addressed the biggest challenges together and done what it takes to resolve them. And I think on the case of what I see right now, where I would like to see more of that is that I think, going back, Joe, to your point on equity of cities, one of the beauties of digital is that we can track situation everywhere. And what data we track, what data we publish, that is the one that gets attention and gets changed. So for example, in the US, Black Lives Matter and the whole social movement has made us much more aware of the inequities once more. And I would like to see that implemented in cities. What is the speed or average speed by neighborhood, not just the one that the city center gets? For example, what's the air quality locally at different regions? How equal is that? What is the speed of getting emergency services? What is the distance to closest emergency services, for example, in large cities? The more we track, the more we publicize, the more we are going to be able to focus on the biggest challenge areas in the city. So I think that's the beauty of digital. We can get a lot of information. We can identify the biggest problems and focus our efforts there. And I think I would like to see more of that. I would like us to do better on the social equity side, given that we actually have real capability to do that.
Yeah, it's amazing that there was a catalyst for that in the environment of the pandemic. And hopefully it gets a lot of traction and there's a lot of progress in that regard for the Black Lives Matter social equity campaign. So Kim, final, I think, to talk about opportunities with technology and collaboration.
I think that so much has been said already, excellent input. So I might just pick up on a question that I just saw that we all saw come up.
Great, thank you.
Okay, by Jessica Guy, and thank you, Jessica. And it's really the question of how, as I understand it, how can we take these tools that we're talking about in cities that are I'm going to add a bit to Jessica's question, that cities that have more resources than others, how do we make this global? And I think that's for me, it comes down to what do we value? And in this case, do we value equity? And if so, do we value digital equity? I don't think the problem isn't so much for me that we have a lack of resources. I think we could do a lot better on making sure that technology is addressing inequity gaps and empowers citizens. On calls like this, I was on a call yesterday with the Harvard University Disability Project, and the call, not like this, it was 20 minutes late to get started because they had to make sure that the sign language interpretation could be seen by everyone. And there were some computer glitches, but it just reminded me that none of this is as easy as it sounds, and that we have to really be dedicated that equity for all is the only kind of equity that we should be talking about. And in terms of sharing best practices, that only goes so far if you're dealing with a student or a class or a school that doesn't, for example, have a computer for every student. I read an article in the New York Times, I think over this past weekend, about a girl about 11 years old living I'm in New York City right now, living in this city. And she's an honors student and she doesn't have a laptop. How is she going to be able to get through school? So I think that as much as we have so many advances and so many things at our fingertips, we have to go much deeper and much wider. And Jessica, I hope that helps to answer your question.
That's great. Thank you, Kim. And I think Jaana or Joe or François, have you guys actually experienced sharing data? And can you guys give examples of that?
Maybe I'll start with a non-technical point of view, because I think my two colleagues here are a little deeper into the realities. I think that, I think it's a really interesting question. I mean, obviously, as I think François said earlier, I think people from different sectors have really been coming together. I've seen in the New York situation, many people in urban planning, transportation, policy, housing have really begun to engage with each other and look at the equity question, and especially in built spaces and urban environments, and also obviously around the COVID concerns. About how other sectors can protect individuals and avoid health problems. And so that data sharing, I think, has been very positive. I think the tendency is that it happens in emergencies and it doesn't happen after the emergency's over. So, and because it's very challenging since people, need to learn how to talk to each other. There are different funding streams, funding different data sources. And then if you're working at a city level, you've got to have the sort of pulling agencies together, the political leadership to pull agencies together. So I think it would be great to learn from this experience, both to plan for the inevitable future emergencies, but also really begin to develop those connections in a more sustainable way for everyday life going forward. It would make a big difference, I think, in health and cities, certainly.
Yeah, that's a really good point. And I think that there's also something else that needs to be addressed, which is trust and responsibility with the data. I know that since the pandemic started, a lot of sources have been reporting on the pandemic, and there's been a big disparity between the different sources. So I think that that's another thing that we should think about. Jaana, you had some input on that?
Yeah, so actually, my experience has been almost the opposite, in a way that one of the challenges of the fragmentation of the cities, there's so many cities that often have a relatively fast changing management team, etc., that we have had a number of different organizations that have tried to do the best practice transfer, finding a way of connecting cities, but it has been such a crowded space. There's so many different groups, so many different initiatives that we haven't had the kind of a centralized source for where you could go for example, if you are interested in water and best uses for your water, if you're interested in air quality, if you are interested in addressing challenges of equity or homelessness or other challenges in specific neighborhoods. I think the challenge is that there is so much of it, but it is so fragmented. So I think if you are looking for information on something specific, I think there are a number of organizations that have good websites that have worked on specific topics, whether it's C40 on climate change, the Bloomberg Cities initiative that actually integrates a number of larger cities. Even European Union now have an Intelligent Cities Challenge that brings together 100 cities around the EU to work on digital topics. The challenge is almost the opposite. There's so many of them. But if you have a specific area, for example, in mind, I'm sure anybody of us can put you in touch with some of the folks who are actually very well connected on those networks and can tell you more, because there actually is a lot of that happening. It's just not necessarily easy to find because the space is so crowded. There's so much happening that you don't really know where to go. Googling it won't help because there's too many sites to click on.
Yeah. There's also that city health dashboard. I don't know if anybody's looked at that before.
Yeah.
François, do you have some input on this?
Is it myself? Sorry.
Yes.
Sorry. Yeah, I mean, indeed, the data is back to what Jaana was saying. We see a proliferation of data. I mean, 5 years ago, we didn't get any data anywhere. And all of a sudden, if we're looking at least in Europe, but we see many countries open data in cities make it actually the challenge quite the opposite, meaning we want to get from big data to small data, actually. 5 years ago, we didn't get any data. We just wanted to get the basic information. We had a project last year in the city of Grenoble around healthcare around sports, around prevention, medical facilities, air quality, many aspects. And we tried to leverage these open sources, and we got close to 60 sources actually of data. So the actual challenge was to aggregate the information, to get normative information, to get a little bit of artificial intelligence to help us, but in a very heterogeneous context. So actually, back to the question that was asked earlier, indeed, the big challenge we see is how we can share on a very large scale of this data. And today we've got this challenge to narrow down basically the sources, narrow down also the objectives. So what we started to come up, and we did in close to 25 urban projects, is a play-like approach, a game called City Play. It's a kind of board game, if you will. And we engage with mayors, with investors, senior citizens, students, and they play their roles and they're telling us what kind of data do they want, what kind of goals do they want to achieve, where do they want to project themselves. And from that exercise, then we narrow down the data. And then we look at it, try to aggregate, correlate, and look at some of the actions. Because indeed, we got quite a ironic situation whereby the data we've been striving for the last decade or so now is everywhere. And being everywhere is getting nowhere also. So this is our goal, is really focus and get these incredible tools that we have, including AI, to really focus on very specific and contextual health issue and social issues.
It's really hard to do.
Very hard, very challenging.
Very hard to do. So thank you for that. So why don't we go into, if you guys could each talk about one success story that you had and something else on the opposite side that failed that we can all learn from. So one success and one failure that we can all learn from. And Jaana, maybe we can start with you, please.
Well, one of the things I would say that we are, and what many cities will be thinking about, and particularly now when we know that chronic conditions make people much more vulnerable, is how do we deal with aging, the fact that older people tend to be more likely to have health conditions, and how do we help them thrive in the city? So I have two examples of great smart city solutions that make life easier for older citizens or people with disabilities. One of them is the Green Man Plus, which is in Singapore, for example. If you have a card, special card that you're giving for people over a certain age or people with disability, that you can go and on a crossroads, you can tap the traffic light and it gives you more time to cross the road. So you don't need to rush, you don't need to worry about not having enough time to walk across the road. I think that's a simple thing that makes it much less stressful for people who need more time to cross the street to be able to move freely and comfortably in the city. The second one is the London Tube has an app that's called Wayfinder for people with visual impairment. It basically gives you, through your phone with exact location, advice on how you can navigate the tube changes from one tube to the other one. Anybody who has been down there and trying to do that, you know that it must be challenging just about for anybody. And I think that's another one of making cities accessible and easy and comfortable for everyone. Given that I gave two of them on the positive, I think if I may jump on and leave the unsuccessful examples for others.
Okay. Kim, how about you?
Well, for the successful, I just want to, I'll give an example, but I also want to give an answer within the way the question is phrased, because we really need to define what we mean by success and for whom. And who is being left out is always my concern. And when we have research and data that's very, very good, and each of my fellow panelists has pointed out that we've had really almost an explosion of that in the last years, I come down to be asking who's that research being done with, not for, and to make sure in my center, along with my colleagues, we only follow Indigenous research methods, so that when we're researching something, that the research is really done with the community and belongs to the community. And I would say that when we look at the way a lot of systems of I know I'm being very general, systems are designed, including one, this is very specific, the system of cities built around cars, which we know Jane Jacobs wrote a great deal about. We tend to find that decisions are being often made at the expense of people and what we value in terms of having accessibility for all. So that would be a where success doesn't lie, and to make sure that we ask what is it that we mean by success, and also what is it that we need to do in terms of an age-old problem I see as weighting, W-E-I-G-H-T, weighting variables and findings. And we see this, I believe, now on pretty much a daily basis in the U.S., where, as I mentioned, I am currently, where mayors of cities are coming forward, talking about what their city needs and what needs to happen in terms of response to COVID, and they have a federal government that might be telling them something completely different. So we need to wait whose decisions matter and where is that information coming from. So I'm a big proponent of participatory democracy, and whenever I see that, I tend to see a better chance of success. In terms of a specific, I would mention Data-Driven Lab, which is a partner of ours. It's a research group based out of the National University of Singapore and University of North Carolina, Chapel Hill, for a few years. Together, we developed the UESI, the Urban Environmental and Social Inclusion Index, which is the first spatially explicit dashboard for cities to measure progress towards sustainable, inclusive environments. And this one I mentioned because for me the most exciting part is that social equity is taken in as a key metric, and that inclusion and environmental success, however we define success in terms of sustainability, livability, walkability, our relationship with nature, a lack of gentrification, and or at least being very aware of mitigating the damage, can be taken into consideration. So we see those two aspects, environment and inclusion, regarded equally. But I still want to say that the challenge is, what do policymakers take up, and what are the variables that especially in a crisis, that budgets will go to and what they won't go to. So I think in terms of governance, we always have to be very mindful there. Thank you.
That's great, Kim. And in the chat feature, somebody asked if you could include that social inclusion index in a link to that, if you don't mind.
Oh, yeah, sorry, I wasn't noticing the chat. I'd be happy to do that.
Yeah, it just popped up. So
thank you.
How about one success and one failure from you, or something that we can all learn from that just maybe didn't go the right direction?
I'm sorry, I think I'm the only one who hasn't spoken. I didn't hear that. There was a breakup in the sound. Yeah, I think these are, I'm not I can't take any responsibility for one direction or another, but I think looking at the global space and local space, one, I want to sort of pick up on Kim's notion. I think on the negative side, we've got to start a foothold perhaps in what I would call creating demand from policymakers to learn more about cities, how they function, and how they can sort of govern to improve health and health equity. But we've got a lot of work to do. So I would say that's still a lot of unfinished agenda there. On the positive side, I think that there have been the focus on cities and on urban health in the research community and the academic community, and to some degree in UN agencies. I think we've seen really positive partnerships with the World Health Organization, UN Habitat. They recently issued a very comprehensive source book with case studies on cities and how they're addressing broader determinants of health, which are a very, very important resource. And I'll put that on when I stop talking. But it's something I think people should really look at. And I think people are starting to, scholars and people involved in policy work, entities like McKinsey and others have really put cities on their agenda in a way that I haven't seen before. And certainly they have many unique characteristics, which we need to understand better, but also the urban health, seeing those two words together has not been easy. I mean, you can go to a whole meeting on urbanization and never see the word health, and you can go to a lot of health meetings and never see the word urban. So I think that's something that's come out of this that is a real positive from my perspective.
Very good point. François, how about a success and maybe a failure from you?
So starting with the failure, but it's always hard to blame others. So I will not name the city, but it's a city in South Korea that was a pioneer in smart city, and frankly, it learned a lot. We engaged in several conversations with them, and I recognize that they had some learnings along the way, because they were the very first to try to use, we're talking about the digital tools, maybe 10 years before everybody used some of the tools to try to tackle, measure, and implement some of the health, social, and global measures. The issue is being, that's really a top-down approach. And actually, I don't qualify that completely as a failure because it benefited both all of South Korean cities, actually global cities. Talking with the vice mayor of Busan, told me, thanks to this experience, actually we are today tackling real-time, flexible, decentralized, urban, and to Joe's point, also healthcare issues. Not, of course, including looking at mobility, looking at energy, but healthcare definitely being one of these issues. Seoul did a tremendous effort also in the last couple of years by learning from this so-called failure, which is actually a success if you say it's a seed that help others to benefit from its learning. On the success, I would actually we do engage quite a lot with UN Habitat, and indeed we are quite impressed. Back to Joe's point, they issued just a few weeks ago, and 64 countries are engaged. And this is, to me, goes back to some of the bright also sides of crisis. You see these unbelievable international efforts and knowledge being shared. And taking an example in a city, I will name the city of Fujisawa in Japan, where I was very impressed. I went there twice. And here, back to what Kim was saying on decentralized and governance. The governance is actually unofficial, meaning it's non-elected citizens that basically have an informal council where they look at social, healthcare, resource management issues. This on the backdrop, of course, of a huge crisis and drama, tragedy of Fukushima, where there has been really willingness to have a very decentralized and very fast reactiveness to issues. And this city, among many other cities in Japan, but I was very impressed by what they did, is really using these digital tools to have real-time reactiveness, basically, and a very informal mode of governance that was non-elected, but very complementary to what the mayor's office was doing, and very actually liked by the city's office. So that was to me a very, very interesting example. They're still learning, they're still in the learning phase of this new paradigm of, I would say, decentralized and resilient urban way of tackling these challenges.
Still learning is good. We have to all keep learning. It's going to be continual, right?
Yeah, definitely.
So kind of switching gears here, if you were mayor for the day of a brand new city, what is the foundation you would start with and why? Joe, would you like to start? Uh-oh.
It's a tough question. I do think that it's really important to bring in a leadership team that is about collaboration and interdisciplinary collaboration and interagency collaboration. I think it starts there, and then I think also the group of people who have the levers of city government that are committed to working collaboratively and to working with communities. And there are many technologies now for community engagement that people are using, a lot more than they ever did before. And they're very much within the reach of city governments to really function in partnership with communities. But I think there has to be the idea, the vision by the political leadership, as well as the talent brought in who have that kind of commitment to make it happen. So those would be my choices, I think, for the people you'd bring in to work with you to make it happen.
Yeah, and that's another thing that's not entirely easy, but it's certainly something that could be focused on. And Jaana, how about you? Mayor of a brand new city.
Well, what I would do first is that I would spend a lot of time trying to get to know my city. I mean, this is a brand new city for me. It sounds like too. So I would try to figure out what's going on with the people in the city, and what are the biggest challenges, or what should be my priorities. However, there was an interesting question on the chat that asked about how do we actually go beyond just pilots and everybody trying to do something at the micro level. So I think if I was the mayor, one thing I have learned of studying cities is that starting from scratch is very seldom the best way, particularly when we are talking about technology. Learning on what other people have done and finding a solution that actually has been tested, proven, and will be sustained will be helpful. Because that's, I'm kind of trying to answer that question with your, after talking to the citizens, I would probably try to figure out what kind of scalable solutions I could tap into so that I could bring not just my city, but others, so that those are solutions that will stay with us. Fragmentation is a big challenge, both for cities, especially small cities, but it's also a huge challenge for the suppliers. There is, I mean, many cities, I mean, I would assume I would be one of the mayors who would be like deer on the headlines with all the salespeople coming and telling me their platforms and how they want to be the single source supplier. It is challenging to choose. It would be so much easier and cheaper if we had some proven scalable solutions. And it's almost like a market problem in the smart city space. And I think that's something, if I was a mayor, that's probably what I would prioritize. I would work together with cities who are facing the same challenges as I have, and trying to find ways in which we can bring in some of the technology solutions together so that we can set the specs and we can just make it sustainable and get to a scale that's achievable for other cities. I mean, I'll give you an example of how this has been done successfully. Some cities have done, these are luxuries for large cities that have developed solutions that they can then sell to other cities, potentially, and almost create a business. I know New York has done that, and I'm sure Joe can tell more about some of those solutions than I can. They have done that in public safety, for example. But I think getting to scale is a big challenge if you want to bring technology to really be part of the solution in a way that it really works and does and solves the problems that face your city's citizens.
Wonderful, thank you. And François, how about you? If you were mayor of a new city?
Yes, I will have to wait because elections were just a few weeks back. So in the next 6 years from now, so thank you for helping me project myself. I think that 3 or 4 key things I would do. The first, actually, it was mentioned a few times, but I think it's very central, is to bring everybody together. It's, I think, increasingly resilience, crisis management needs to be addressed by very different expertise. And meaning, what is striking to me in a number of projects, increasingly, we see that you cannot solve issues by just having a constructor approach, an energy approach, mobility, just healthcare isolated. Everything is intertwined. So I think the first thing for me would be to mingle everybody, to mix everybody, to get them to talk, to of course listen before acting. So this is the first. I would say the second thing I guess I would do is, I was talking about city play, kind of city play, not just because it's a game, because this kind of approach or whatever approach that helps to narrow down to, let's say, 2 or 3 priority, because to get impact, I get this strong feeling that we need to get a very limited set of priority and objectives. And a city cannot achieve, everything on healthcare, everything on social, it has to start somewhere. So to me, it will be the second action would be to say, what do we want collectively? And this would be a debate, whatever through shape, through a game or whatever form, it has to be a debate, and then narrow down to, let's say, 2 or 3 priority maximum. And the last 2 actions, the third would be to have a benchmark of what is being done globally. New Cities Foundation, this kind of forum, or other forum, help bring ideas and cherry pick some good ideas. There are so many things being done. Try, of course, to have them being contextual, but see what's being done and take a little bit of time to stop, to freeze and look at what's being done in these specific areas internationally. And the last one, I would say back to what Jaana was saying, there is a strong question about implementation and rollout, industrializing the approach. And I think here the cities would need collectively to be much more flexible on the trial and error. Proof of concept, if it works, start to deploy. If it doesn't work, start to adapt. Be more nimble. So these are, to me, the 4 actions 6 years from now, of course.
So Pitti for mayor. We've all.
Yeah, please vote.
Kim, how about you?
I would start by cultivating a greater ethos of connection to nature and connection to place. Our separation from nature actually was intentional, and it was thousands of years ago when it happened, around when the masculine was separated from the feminine. And I guess that's for another conference, but to say that it's not enough to acknowledge that we have parks and green spaces and that we need more of those, or that our sense of belonging comes from many sources, including our connection to place. It's to acknowledge, as one of our participants, Jennifer Castenson, has said, we should be also talking a lot now in this remaining time about climate change, and in particular, I would imagine we should be talking about COVID and cities on fires and floods, and what our response could be. And I think it has to be much on my city than I'm mayor of, and my new city may not have the challenges that other cities will have. And I know we're only talking about cities today, but to say that if we had prioritized holistic views, and instead of putting different things in silos, like build a new factory over here, and over here we'll build a nice park, we may not be in such a mess that we're in now. So my strong argument would be to build on a foundation of participatory justice, which would allow citizens and residents themselves to lead to solutions for community thriving.
That's a great response, Kim. And I think, Nadine, that's kind of what would be answering your question there a little bit. And recovery plan would be tied into that leadership that Joe was talking about, the tools, the participatory, the crowdsourcing that Kim was talking about as well. So I think that might be the answer to your question. And then Tiffany Garner has a question about migration. So can we touch on that just a little bit? Or actually, that was Nadine's question as well, migration. So can we touch about migration just for a moment, and then we can go into our speed round?
I just say, I think New York City is a city of migrants. And one of the things that inherently makes cities, challenging but interesting is really the complexity of diverse communities and tailoring interventions to working with those communities so that what you want to do to improve the situation makes sense. I think there are obviously large groups of migrants. The key is not demonizing, but focusing on the positives, the things people bring with them when they come to cities and the opportunities there. It's tough to talk about that right now in this COVID environment, but in general, I think cities offer enormous opportunities if the process of immigration or being an immigrant is valued and not demonized.
Great. Anybody else have some thoughts on migration?
I think the one thing to keep in mind is that when you look at the cities that thrive and grow, they tend to be because of the fact that their population is growing. And as we see the population in cities start slowing down with aging, with slowing fertility, immigrants will be the engine and the energy of growing and thriving cities. It will be the source of new workers. It will be the source of new talent. And I think it is one of those things that we will see a pretty dramatic shift on the thinking over time as we see the demographic story play down a few decades down. So immigrants really are the lifeline almost for cities for long-term success. So I think it is very short-sighted to not make it a priority, to make your city welcoming for new people, making everybody feel at home. And I think that we often don't look at the real statistics of, for example, the business startups, the service businesses and enterprises, small stores, small service operations that are built by immigrants. And so I'm very much with Joe. I think looking 20 years down the line, the cities that are open to immigrants will be the ones that will be in a much better position.
Thank you. I'd like to just add something on migration, if I could, as well. I would just like to ask everyone to be very aware and become an activist about where gaps exist. So, for example, in Canada, I believe quite deservedly have been well recognized for what we've done to welcome refugees, migrants, asylum seekers to our country. And then I would say not enough is done after. So we have a lot of people living in so-called hotels that are not hotels, where there's a big gap from when people arrive to when they're able to get into a home, get into a job, and so on. And I believe that in a lot of our neighborhoods, we're really aware when this happens, and we could be doing a lot more. And just by one example, which is to say that everyone could be doing this wherever you are, but our small and mighty team that I'm part of, we partnered with a lot of with a YMCA that's in Montreal that's being used, and there are a few other places to house recent arrival asylum seekers. There was no and there were no resources from when you arrive until when you get that first check, and then you're on your own. And so for us, it may not be so hard to figure out what the subway system is, to figure out if your kid needs a medical appointment, how do you get it? And all of these things that are such basic resources that can be the difference between making a smooth entry into a new life or feeling really isolated and cut off, and finding that program, that problem really hard to solve. So that one's called Common Threads. But I would say that I come back again to citizen action and what we all see going on in cities and communities where we live, that we tend sometimes to figure that someone else is taking care of that, or the government has the resources, or the institution can handle that. And I think it really just comes down to each of us valuing another human being as being absolutely equal, which they absolutely are. And I think we could do a lot more. Thank you.
Yeah, thank you, Kim. That's a very poignant point.
To pick up Jennifer on Kim's comments, indeed, what is striking in terms of the migrants, the pace of migrants coming and asking for help, for being welcoming, and the lack of infrastructure that we're seeing in the cities. And what is really striking, we're discussing with engaging with mayors, looking also at some of the government challenges, and really the urban reaction is usually, I mean, the time it's taking usually to react is 1 year, 5 years, a decade. When we've got migrants coming, it's, and Kim said it very rightly, it's a matter of days, it's a matter of weeks where you need to put this infrastructure. When you mention a hotel, it is not a hotel indeed. Why? Because building is usually takes 3 years. So we are looking currently, for example, at new ways of construction that are modular, that can reduce the pace, but it doesn't take 3 years to get buildings. When Germany had to welcome 1 million people in a matter of months, they were completely overwhelmed by the challenge, because the cities are not used to tackle the challenges on a very fast scale. And I think it's a collective challenge. I'm talking as a part of a company that is building infrastructure, but we see the collective challenge on the energy, on the mobility, on the social, and the healthcare to be much more reactive, and to be, to Jaana's point, a welcoming city in the years to come.
Wonderful, thank you. That's And I think we only have a minute left. I don't know if that's enough time to get into our speed round, but maybe we can do 2 terms, and we'll do in order Joe, Jaana, Kim, and François. And I just want to say, I'll give you guys a term and you guys can respond to it with 1 or 2 words or phrase. So basic universal income.
Crucial for social supports, but has to be adapted, to the realities, political realities in a country, and move in that direction.
Jaana?
Is it the same word, or are you going to give me another one?
No, it's the same word.
Okay. Interesting experiment. Want to learn more.
Great. Kim?
Wherever we go with that, it needs to be driven by members of the community, not by policymakers that don't have a connection.
François?
Well, I would pick, unfortunately, at the same answer as Kim, but is really being very specific and very contextual, much more contextual.
All right, well, I think we have officially run out of time. I don't want to keep everybody longer, but it was such a pleasure talking to each one of you, and thank you so much.
Thank you.
Thank you.
Thank you.
And thanks to everyone for the questions from the chat and the comments as well. They were excellent.
Yes, thank you all so much. Thank you to our audience for the excellent questions. I was following along as well during the entire session. Thank you, Jennifer, for your excellent moderation of this as well. And I would encourage all of you who are listening and watching to check out the McKinsey Global Institute's report on prioritizing health. I was scrolling through it throughout the session there, and it's linked on the session page. So with that brings us to our final session of the day, a bit of a more relaxed pace here on day 2. I would encourage you all to go into the program and head on over to the Canadian Mortgage and Housing Corporation's Housing Supply Challenge. This is their ongoing exercise to basically address many of the issues that we've talked about in this session and today and throughout the conference, which is to address obstacles to housing supply and affordability, how to enhance community engagement, and cultivate collaboration and partnerships across various sectors. So I would encourage all of you to attend our last session. So thank you again to our moderator and panelists, and thank you to the audience, and we'll see you over there shortly.
Thank you. Bye.
Bye-bye.